I honestly believe that many dogs can thrive behavior-wise with the right support. And sometimes that includes medication. It is Jose here from Try Me Please. Let's go. Today, I'm really excited because I'm joined by Dr. Jen Nesbitt-Hawes, behavior vet and founder of Pet Perspective. Jen, thank you so much for being here.
Hi, Jose. Thanks so much for having me.
Fantastic. I know many pet guardians have questions about how medication can support dogs with behavioral challenges. So let's dive straight into it. Many people worry that if their dog is prescribed medication, they'll just be sedated. Can you explain how these medications actually work to help dogs struggling with fear, reactivity, or aggression?
Yeah, look, that's a really common concern. And certainly when we're prescribing medications, behavior medications for dogs, we're not aiming to have them sedated. We really don't want to change their personality or to make them more dopey. It can be a little bit of a side effect for some of the medications that we use. So sometimes if we're seeing that side effect, we may decide to change medications or we may reduce the dosage of the medications that's been prescribed. However, what we really want to do is to reduce the emotional arousal of the dog. And so when dogs or any animal really is really highly emotional and reactive, they're at a point where they're just sort of responding to the environmental stimuli around them. They're not able to think really clearly. And so that's what we're trying to do with the behavior medications, is to reduce the amount of that over-arousal that's going on, and allow that thinking part of the brain, that prefrontal cortex, to really start working to be able to let the animal learn as we're going through our behavioural modification plan.
Will medication by itself fix a dog's behavioural problem, or is it usually part of a broader treatment plan?
Yeah, medications aren't a fix for dog behaviour problems, unfortunately. It would be nice if we could just give them a tablet and all the behaviour problems would go away. What our medications do is to allow the brain to think more clearly, and also allows the dog to cope better with really challenging situations. So for some dogs it might be separation distress, or being anxious about being left alone. For other dogs, it might be being really reactive, so seeing things when they're out on walks that they find really triggering. So our medications aren't going to stop those problems from happening, but what they do is that they allow the animal to relax and allow the animal to better cope with those situations.
If a dog starts medication, does that mean that they'll need to stay on it forever?
So if a dog starts on medication, it doesn't always have to stay on it forever. There are a couple of different kinds of medications that we use. Some of them are short-acting medications, and these medications are just designed for a specific event, short-term sort of event. So this might be something like a thunderstorm, or it might be an event like a veterinary visit. And these are just short-acting medications that we use. And often we can use these intermittently. We don't have to necessarily be using them every day. But then we also do have longer-acting medications. And these medications take a long time to work because they require changes within the brain to actually make them work. And fluoxetine is one of those. There are a few different medications that a dog may be prescribed. These medications can take up to 6 weeks to start working, and then we may find that we need to adjust dosages and things like that. So often once we're on those sorts of medications, the dogs are on them for at least 9 months to 12 months before we start to taper them off again, and it's not safe to suddenly stop those medications. Some dogs do really, really well, and we might find that we decide to taper them off, but as we're tapering down, we find that the problems are coming back, that the dog actually needs that support to be doing really well. And these dogs we might keep on medications lifelong. But then there are other dogs who we taper off the medication and they do really fine. And maybe that's because whatever was initially causing them the problem, that stimulus is no longer in their environment. Or maybe it's because our behaviour modification plan has been really successful, and the dog is actually now able to cope in those situations without that medical support.
Every dog is an individual, and is it common to need to try different medications, doses, or combinations before finding the right fit?
Yeah, you're absolutely right. Every dog is an individual, and it can take a while for us to find the right medication to suit the right dog. And certainly, the more experience a vet or a behaviour vet has, the more intuitive they may be about selecting the medication for the particular dog and for the particular situation. But it's always going to be a little bit of trial and error. And so what we'll do is we'll try a medication, we'll try and get it to the dosage that we think is working. So if we're initially finding some improvement but not a lot of improvement, we may say, okay, well, this seems like a good fit, but maybe we need to adjust the dosages slightly. Sometimes we find that we have paradoxical effects that we weren't expecting, or side effects that really don't fit well with the dog. So the dog may not have as good an appetite as usual. The dog may become more excitable than usual, which is something that normally we don't want. And if that's the case, we may find, or in the case of a dog who doesn't respond at all, we may find that then we need to change the medications over and use a different type or a different class of medication. And sometimes it's also a matter of mixing in different medications as well. So we talked about there being long-acting medications and short-acting medications, and sometimes we'll actually use a combination of medications to be able to tailor it to that particular individual.
How early is it too early to consider medication? Are there advantages to starting sooner rather than later?
Yeah, this is a really interesting question. There isn't a specific age where we say, look, it's too early to start medication in most cases. And in fact, the early period of brain development while the puppy's still learning is a period where there's a lot of different growth in the brain structure itself. And if we can actually make changes within the brain during that stage, then what we can find is that we strengthen the connections that we do want, the connections where the animal is able to think clearly and act in what we consider an appropriate sort of manner, rather than behaviours which are more reactive. The longer that we leave an animal repeating a behaviour, the more entrenched that behaviour is going to be in that animal's behavioural repertoire. So the more likely it is to come up again when the animal is emotionally aroused. It's going to fall back on those behaviours that it knows and that it's repeated again and again. So it's another reason for us to sort of start intervening earlier rather than later.
What are the signs that a dog might benefit from medication? For example, do intensity, recovery time, or quality of life play a role?
So we might consider that a dog would benefit from medication when the behaviours that they're showing don't fit the context really well. So maybe the behaviours are more extreme than we would expect from a dog in that situation. Maybe the behaviours are abnormal for that context. So, for example, dogs who might be fly snapping or circling, the behaviour might go on for a longer duration than we might expect, or maybe the behaviour goes on for a normal length of time. So say that's a barking behaviour. The animal sees something in the distance and they bark at it, but they get so excited by the barking that then they're not able to relax again for a really long period of time. Or it might be that they go to the veterinary clinic and they get very, very stressed at the veterinary clinic, and then when they come back home again, it takes them a really long time to be able to settle, and they're really jumpy. It might be a dog who's just really, really alert, hyper alert all the time, doesn't really sleep very much, is just often looking out a little bit like that sort of meerkat kind of thing. Just always looking out for what might be going on. Is there something that I need to be concerned about? Or it might be an animal who's anxious in situations like being left alone or thunderstorms, and that's really impacting on the animal's life, often impacts on the caregivers' lives as well. So the quality of life of the animal plays a role. The extremity of the reaction plays a role, and whether or not we think that that's a normal sort of behaviour for the situation. All of those sort of things play a role in our decision as to whether or not we might give medication. The other thing that actually can play a part is if we've already tried behavioural modifications and positive reinforcement training, and we might have made some improvements with that, but then we either plateau or the animal's just not able to learn, it's not able to get anywhere because it just can't really focus. And that could be another situation that we might decide it's appropriate to use medications.
How important is it to combine medication with environmental management and a behavior modification plan?
Yeah, look, this is absolutely key. So, as we discussed earlier, medications on their own rarely actually fix a behaviour problem. What they do is they put the animal's brain in a state where it's able to learn and able to really benefit from a behavioural modification plan. And so what we tend to do in behaviour is we tend to have environmental management, which may involve trying not to expose the animal to really stressful events until it's ready to do so. Behaviour modification, where we teach the animal the kind of behaviours that it can do instead of those really reactive behaviours that it might be exhibiting. And we also find it really important to monitor. So we're monitoring not only is the medication working, what's happening with the medication, but how's the behavioural modification plan going? Are there any things that we can tweak? And there's pretty much an unlimited number of different things that we can try, but it's really trying to make those key changes to the environment, to the way that we're handling the animal, and to the training plan that are going to then allow that behavioural medication support to actually work. So it all comes in together.
Can underlying medical issues like pain influence behavior problems? How do these factor into treatment decisions?
Underlying medical issues can actually play a huge role in behaviour. And increasingly, we're starting to realise just how many animals actually have pain or other medical conditions as a contributing factor to their behaviour. And that's certainly understandable. You know, any of us, if we're feeling pain, if we've got a headache or a sore tummy or a joint ache that's happening all the time, that's just going to make us a little bit more cranky and a little bit more irritable and a little bit more likely to do behaviours that perhaps we wouldn't otherwise. And the same thing happens for dogs. So it's always really important before we start animals on behaviour medications that we look at underlying medical causes for their behaviour. And we may start treating at the same time. We may start treating for pain as well as starting treating with anti-anxiety kind of medications. Or it may be more of a stepwise approach where we say, okay, well, look, we really need to work on what might be causing this animal pain. Maybe it's looking like it's got sore hips. Maybe it's looking like it's got sore teeth. Maybe it's looking like it's got a skin condition, so it doesn't necessarily have to be pain, but that discomfort and that itching. So maybe we address those things first and then we move on to trialing some behaviour medications. It really depends on the intensity of the behaviour and how much of a problem it is and how quickly we really need to address it for the sake of that dog, that individual dog, and for the family that's surrounding and supporting that dog.
What would you say to guardians who are hesitant or nervous about the idea of using medication for their dog?
Yeah, look, putting a dog on behaviour medications is never a decision that anyone would make lightly. And I certainly think that we really do need to weigh up the benefits versus the costs. There are the potential for side effects. It can take a while for behaviour medications to work. It can take a while for us to find the correct dosage and the medication that suits the individual animal really well. So, yeah, it's never a decision that we're going to make lightly, but it can have huge benefits for the animal. And there are many cases where people have been sort of hesitant about doing it, and then they've sort of tried all the other options, and then they try some behavioural medication to help their pet. And they say, well, we've never seen our dog like this. His personality is just shining through. Everything is so much easier for him and therefore for us. And we wish we'd done this ages ago. So it's certainly something that can have huge benefits, especially for these dogs who are really, really struggling with their behaviour issues.
That's been some incredibly valuable insight, and I'm super grateful to Dr. Jen for sharing her knowledge in this video.
Thanks, Jesse. Thanks for having me.
You'll find links in the description below to learn more about Jen's work and the projects she's involved in. If you found this video helpful, could I please ask that you click the like button below? It really helps more people discover this content. If you'd like to support what I do here on YouTube, you can buy me a coffee online or check out my comprehensive behavior modification principles course. And when you're ready, here's the next video I recommend you watch. Obrigado e até breve. Tchau!